Right, well, good afternoon, everyone, and welcome to this is session number 2 in a series of 14 through ACTE, the system supports post-secondary, and it's regarding planning for and resuming high-quality CTE at post-secondary institutions. I'm Rick Bullion. I'll be your moderator today. I'm the Associate Vice President for Workforce and Economic Development at Salt Lake Community College in Salt Lake City. Just a couple of notes, housekeeping notes. If you would, please mute your microphones. And then also, we do have a chat box that if you have questions towards, probably at about 45 minutes, we'll have the opportunity for you to ask questions and we can get those to our panelists. But before I introduce our panelists, first up, I would like to introduce the Senior Director for Policy at ACTE, Alicia Heislip. And Alicia, thanks for having us on, and take it away.
Thanks, Rick, and thanks everybody for joining us this afternoon. I just wanted to start and provide just a few comments to frame the organization of this webinar series to help you see how this topic and all of the others that will be discussed throughout the 14 that Rick mentioned fit together. Some of you, maybe many of you on the call, may have seen ACTE's high quality CTE program of study framework in the past. We started developing it around 2015, and after a lot of research and pilot testing, it was released a couple of years ago, back in 2018, with these 12 elements that really sought to address the things that needed to be in place within individual CTE programs to ensure quality and student outcomes, so that an individual instructor or maybe a local dean at a college overseeing workforce development programs could kind of pick up this framework and say, how is my nursing program doing? Or how is my engineering tech program doing in meeting these standards around quality CTE? Over the past couple of years, as the framework has been out in the field, we've had lots of conversations with people about other things that have to be in place to ensure high quality CTE programs. And that's where the 13th element that this webinar is going to cover comes in. And that is system supports. This is a new element that we are just beginning to add to the framework, and you'll start to see more resources roll out over the next few months that isn't specific to an individual program that nursing faculty member might not be able to address the supports that are in place for their program, but are just as critical to program success. The overarching elements like funding and policy and alignment of the programs across your institution with workforce needs and how you recruit students to your institutions, the foundations on which all of your programs are based. And so this new webinar is where we decided, this new element, system supports, is where we decided to start this series of webinars this summer that will eventually cover all of the elements in the framework. So today, as I'm sure Rick will say again here in a minute, we're going to be talking about kind of those broader decisions that you have to make at the institution as you think about planning for the next school year and how you will adapt learning in response to the COVID pandemic. And each of the webinars that follow will then dive in deeper to the individual topics that you saw on the previous slide, things like work-based learning and equity and how to prepare your staff, all of which might be touched on today, but will be covered in more depth in the rest of the series. So with that, I'll turn it back over to you, Rick, to kick things off.
Thanks, Alicia. Well, it's really an honor to be joined today by 3 very prestigious presidents, all supporters of career and technical education. First, we have Dr. Annette Parker, president of South Central College in North Mankato, Minnesota. Dr. Karin Hilgersum, president of Truckee Meadows Community College, Reno, Nevada, not too far away from Salt Lake Community College, and Dr. Aaron Fitchner, president of the Council of County Colleges in Trenton, New Jersey. So you'll see different, and you'll hear different perspectives today because obviously We have everything covered from the West to the Midwest to the East. And so with that, I'm going to throw the first question out. And Dr. Parker, if you'll take the first crack at it, if you would, just introduce yourself and maybe kind of the state of how CTE is working right now during this incredibly unusual time during this pandemic at South Central College in Mankato, North Mankato, Minnesota.
Thank you. Hello, everyone. Let me talk a little bit about what's going on in the state of Minnesota to kind of set a frame for you, a vision for you of how we're going about addressing reopening our CTE programs. Here in Minnesota, the governor shut down and put in a stay-at-home order starting March 30th of this year. And we extended our spring break 2 weeks before that, and we're in the process of moving everything online that could be moved online. And just before we thought we were going to be able to open up after spring break, the governor decided that the hands-on courses, which meant the CTE courses, could not return. And so they had been in a pause, so to speak, until a recent state order, Executive Order 20-50 in the state of Minnesota, that said that we could bring back our students that were in essential worker fields, the graduates only, to complete their hands-on components. And so what's going on here in Minnesota is that I have the students that needed to finish their, that were gonna graduate in May, that were in CTE programs. They're now here during the summer completing their spring semester. And we're planning to bring them all back in the fall. So what that means is the students that were in their first year in a CTE program will be completing their spring semester as well as their next sequence of courses, and with some social distancing, making sure that our spaces are sterilized, and some other things that I can talk a little bit more about as we progress through the conversation.
Great, thank you, Dr. Parker. Let's go to President Hilgerson at Truckee Meadows Community College.
Hi, everyone. It's nice to be here today. So at Truckee Meadows, we serve the Reno-Sparks area, and one of our claim to fame is that Tesla the Gigafactory is very close by. So we've trained hundreds of students, probably thousands at this point, for entry-level jobs with Tesla, who also subcontracts with Panasonic. So Panasonic is actually even a larger employer, and they're also located at the Gigafactory. What that meant is that we really needed to get those CTE students to completion as fast as we possibly could. Not dissimilar to what Dr. Parker just described, is that at first everybody had to sort of go home. We moved as much online as we could, and then the governor in the state of Nevada made an exception for CTE and health career programs. So we started completing those students a couple of weeks ago. And just to kind of give you an idea of what that looks like, and this is both in some of our health careers, but also our advanced manufacturing. And the building is in lockdown. Students come into the building, they're sent a link before they arrive, and every day they have to complete a survey which talks about have you traveled? Do you have any COVID-19 diagnosis or symptoms? Have you come into contact with COVID-19? So they complete the form, we take their temperature, then they can enter the building.
Wow.
When they're in the building, they're socially distanced, they're wiping things down, everyone is wearing masks, they're trying to keep the equipment very clean and make sure that people aren't touching the same equipment without a disinfectant in between. And at the end of the day, the folks out at those campus locations send a report to facilities to let them know who was in the buildings and in what rooms. And we do this so that if someone does test positive, we can go back and do the contact tracing with little difficulty. I can tell you I've heard some very interesting stories from my friends at Panasonic. who had one incident where two mechanics were working on one of the assembly or the robotics lines. One of them was asymptomatic and apparently probably exposed the other one, who became symptomatic to COVID-19. Since that time, Panasonic has really overhauled their procedures, and they've had no positive cases since. And since there's about 3,000 employees out there, that's really good. So we're learning a lot from our industry partners, and they're learning from us on how to do this, because in the Reno-Sparks area, we can't afford to stop CTE programs. They are counting on us for that workforce pipeline and for those health career professionals that we train every day.
Thank you, President Hilgerson. And now we'll go to President Fitchner out in New Jersey. And President, as we see maps of the United States and the COVID-19 incidences, wow, the Eastern Seaboard, it just is lighting up red. So this impact has to be very severe with where you're at.
It is, and it's an honor to be here with a very distinguished panel and to be with you here, Rick, and everyone in this presentation. And so I appreciate your thoughts and prayers for us here in New Jersey. So yes, we have been at the epicenter right between New York and Philadelphia. We've unfortunately had 12,000 deaths from COVID-19 in New Jersey, just past that very, very terrible milestone this week. We have 164,000 cases. So we are further behind, I guess, everybody else in terms of opening up. So Governor put a very, very strong set of orders in place to really shut down all in-person education in early March. We've been under those orders. We're expecting some updates from the governor on June 15th about what might come next. There is a waiver process in place, and some of the 18 community colleges in New Jersey have received waivers for a small number of healthcare and CTE programs, but those are really the exception. And so what our colleges have been doing is trying to find all creative ways to deliver high quality CTE programs in a virtual environment. And we can talk more about some of those strategies. None of them are ideal. And we are knee deep in planning, waiting for the governor to give us more guidance in mid-June about what comes next. There's a lot of uncertainty, a lot of budget pain, but I think, as the others have said, there is no more important time for CTE to play a lead role in helping to rebuild the economy, build a healthcare workforce. So we're very focused on what we can do in our 18 community colleges, adjusting to a very, very challenging set of uncertainties.
Great. Thank you very much, President Fitchner. The next question, and I'll go ahead and rotate. I'll start with President Hilgerson. One of the things that we've seen around the country is potentially the lack of inclusion for CTE leadership and professionals being at the table, because, you know, let's face it, none of us have ever faced anything like this in our careers. And when it came time to pivot as an institution, the successful pivot was, quote unquote, we're taking it online. Well, there are only so many things that we could do online. All welders, there are some theories. They would like to keep their fingers, and eventually that means you have to get, you have to get into the lab. And so one of the questions that I have from a leadership position in your states, in your systems, were you, or did you have a representative in your system that was at the table making these pivot plannings for your institution and your state?
So I guess yes and no, and I'll just describe the process. I think there were many voices, but at the very beginning of this, our governor was very quick to declare a public health emergency and pretty much shut everything down very, very quickly. So, and I think that was the correct behavior at the time. And we really didn't have a lot of choice in that. So when that happened, we pretty much vacated our campuses with very few exceptions, because the governor was very clear on that. And we are governed by a Nevada System of Higher Education, NSHE, and they were also taking the lead of the governor. After that happened, however, at the local level, we began having some really good conversations with our CTE and health careers faculty. and asking them what they wanted. And we tried our best at that point to be their advocates. And I think at the end of the day, that type of advocacy prevailed because the governor did permit exceptions to CTE programs and health careers training pretty early on health careers for obvious reasons. Get those nurses graduated because we might need them in the next 2 weeks, right? But for the other programs, that took a little bit more time, but I think our governor has been very good at responding and listening. And it was great that faculty wanted to come back and help their students complete, because that's had a personal risk to them too. But I think they were really feeling upset for their students, and they really wanted to do their best to get those students through. And I think we've taken some really great precautions using the advice of the CTE individuals, Washoe County Public Health, some of our science folks who were also very good at helping us establish protocols. So I think what's most important here is just establishing those health and safety protocols so that we can get this work done.
President Fitchner.
So I think I agree. The answer here is yes and no. I think the decisions that the governor has been making have been driven initially largely by the public health concerns. And as you know, I said before, we were at the epicenter of this. And I think that the number one concern, the number one voices at the table, understandably so, were the public health experts who were saying we needed to be very, very careful. So we've been very much at the table working with our Secretary of Higher Education to think through how we emerge and make this transition, obviously making the case for the need to be a little bit understanding about the essential in-person component to CTE programs. We're very happy to see the Secretary put together a waiver program, and they've granted a lot of waivers to healthcare and some CTE programs. I mean, not a lot, but more than we might have expected at the beginning. So we've been at the table. Hard to say that we're driving the decisions, but I think that's understandable. The governor has convened a higher education reopening task force, which includes 6 community college presidents. Unfortunately, a lot of the discussion is dominated by our 4-year partners, talking about dormitories and talking about liberal arts. We're doing all we can to make sure that our voice is heard, but there are so many voices, there's so many complexities in this issue. But I think we're making progress, that we're starting to see the way towards reopening more and more programs in a safe way.
Great. President Parker, how about Minnesota?
Well, let me first say that to my colleagues in the webinar that I am a CTE professional myself. I started off as a CTE teacher after I left General Motors. So I came out of manufacturing. And after being a faculty for 12 years, moved into administration and now into this role. And so I've always played an integral part around the policy that affects CTE in our state and at other national levels. I'd give a shout out to my dean that I know is on the call. She understands that and appreciates that. Let me just say that there was a lot of committees at the state level that talked about how we first shut things down, and then how we, as our governor says, turn the dial back up. And that's through stages of reopening. There are committees at the state policy level, the Minnesota Management and Budget, Minnesota Department of Health, all engaged in the protocols of returning. But they have faculty and staff from the public and private sector and administrators working on reopening. And we've been able to embed as many people as we can in that conversation. For example, one of my first responder, the guy that does our first responder emergency management training is on the committee to help think about reopening. And he heads the regional Department of Health. So we've got that kind of look into it. I have always supported the reopening, and I stay in the chancellor's ear about what the recovery looks like. The recovery is going to require us to have CTE up and running. And so to my colleague's point, Karen, earlier about working with business and industry, you really need to make sure you do that. And so I engaged our chamber, our regional employers. When our students couldn't finish, many of them were able to finish through apprenticeship and through internships with our employers. And what we learned, for example, is our regional chamber of employers were having demands in high demand areas. And so serving on their board, then I began discussing with them, how can you help us help our students complete? And it's through those public-private partnerships that we've been able to get students to complete courses without needing to be on campus. And I'll talk more about that as we talk about how we reopen in the fall.
Great, thank you. Well, it's time to talk about our favorite subject, and that's money. I know here in Salt Lake City and state of Utah, we're just finishing our fiscal year. June 30th is the end of this fiscal year. We've been asked as an institution to give back a certain amount of money to the state, and we are awaiting what our cuts will be for next fiscal year, which starts in a few weeks. And so we've been asked to prepare either a 2%, 5%, or 10% cut to see what that looks like. I'm interested to know, and especially it's wonderful that we have institutional presidents, what have been your marching orders, and have you, the programs we offer are very high cost, but they are very needed, and obviously that's what workforce is asking for. So I'll start with President Fitchner. Have you been either given a mandate for a cut or anticipation, et cetera?
Yeah, so on top of the public health emergency and the economic emergency, we now have a state fiscal problem and emergency in New Jersey. So state funding for all of community colleges and for all of the four-year college and university was cut in half for the fourth quarter of this fiscal year. Now the governor and the legislature have agreed to extend the fiscal year until the end of September so they can have more time to develop our full FY21 budget. And the governor is proposing allocating $0 to public higher education for the fifth quarter. The theory is that the CARES Act funding will somehow fill in the gaps. So this obviously is having a huge effect on all of our colleges and the very difficult decisions that they have to make about staffing and programs and trying to find ways to preserve the really important CTE programs. We are working very closely with the legislature, and we're hopeful that the governor's proposal will not stand and that there will be funding for public higher education, including community colleges, in the budget for this fifth quarter. And then we are expecting probably a 25% cut after September, probably for the considerable future. And so what we are doing is thinking creatively about what else can we do. We enjoy very, very close relationships to the workforce development programs in the state. Obviously, those partnerships are critically important because there are dollars in workforce development. We have 1 million people in New Jersey who are collecting unemployment insurance benefits who need a path to reemployment. We expect that the economy that we emerge into when this crisis is over will look very different than the economy we left behind. And that means that many people will need to reskill and retool, and CTE will be critical to that. So we're engaging all of our state departments and thinking creatively about how to support CTE with other resources to make the case to the legislature about its importance and the importance of community colleges in general. But at this time when our country, our state needs CTE, needs community colleges more than ever before, we are challenged by the funding. And so I'm sure we'll find the right way out of this crisis in New Jersey. And I know CTE will be at the center of it. We just have to figure out how that's all going to work.
President Hilgerson, I think I've heard rumors that our neighbors next door, which are Nevada, you are experiencing or will experience some pretty significant cuts.
Yes, so we took a 4% cut, which in effect was a retroactive 4% cut that we basically left money on the table, which was an unpleasant surprise. Now we are in the process of planning for a 16% with furloughs on top of that we don't even get to count toward that percentage. So for TMCC, the cut will probably total between 19 and 20% when all is said and done. Now, on the state side, luckily our college has quite a bit of self-support funding. We also have a robust rainy day contingency fund, thank goodness. So we're going to be fine, but I do hope that states understand and continue to support, especially in Nevada, the role of community colleges as the little engine that could when you're looking at economic development. So, you know, so far we're just crossing our fingers and hope that there's no more to come. But we did convene a fairly large budget reduction task force at TMCC that included faculty, administrative faculty, and classified staff representation. And they came up with a good list of recommendations. And our primary goal is we don't want to lose people. We're trying to save our permanent employees, and we think we can get there. So that's the good news. So I'm hopeful that CTE programs will definitely remain excellent, and that they will definitely have the faculty and the staffing that they need to do a really great job for our region.
Great, thank you. And of course, we all have industry partners, and they do a much better job of advocating than we do, at least in our state. And so we would encourage that. In fact, speak of encouragement, as we round out some of our questions, if you have questions, please put them in the chat box and I will relay them to our panelists. And I know we have over 80 or so on the Zoom meeting this afternoon. And first of all, thank you for taking time to do this. But please put your questions in the chat box, either for the group or someone individually, and I'll make sure that we get that passed on. So with that, President Parker, what about Minnesota?
Well, let me first say that Minnesota started with a healthy budget surplus. We had about a $2 billion surplus going into COVID-19. We're going to end next year with about a $2.4 billion deficit, but that can be covered through the rainy day fund that the state of Minnesota has. And they go into special session, our legislators, on June 12th. So we'll see where that goes. I think we're pretty good this year because we, on our biennium on finances, and so this is a bonding year and not a financial year. Our finances were set over a year ago. Next session, next January, will be interesting about fiscal year 2021. So, and let me also say that South Central College is very financially healthy. We have a good composite financial index. However, we were and are looking at a scenario across our state of all of our colleges and universities of we were supposed to have a tuition increase this year because we didn't get all the legislative support that we needed. We're deciding against that given what's going on. And the board is going to vote next week on a different plan. But we were looking at a 5% reduction in enrollment, 10% and 20%. That left me with a pretty significant gap. What we decided to do, I was able to cover that by not hiring some open positions we had, reducing non-employee expenses. And then we're going to, every Wednesday, I meet with the entire college on Zoom, and we have a COVID-19 update. And so we've been talking about the budget and been able to reduce the non-employee expenses just by everybody chipping in. And the next thing we're looking at is early retirements. And so the way I have it planned is it looks like we won't lose any money until we get to somewhere around 15 to 20% enrollment drop. Now, from all indications of summer semester, which went 100% online, we're up 11%. So I'm beginning to think we won't see a decline.
Yes, ironically, we're up as well at Salt Lake Community College. Well, I know we have many practitioners on this Zoom call. And so from a presidential position, we're either currently welcoming back students, depending upon the location, or we'll soon be welcoming back students to our facilities, our labs, our classrooms, our technical labs. I'm curious, what are some of the practices that you've put in place? And I know President Hilgerson, you mentioned that you're taking temperature. They have to fill out a form either on their phone or computer. And in fact, my wife works at the University of Utah, and she has to do that in order to get into her office every morning. We haven't installed that here at the college, but they are doing that at the university. Once that student is inside and they're in front of your faculty, how are you protecting your faculty and how are you protecting your students? President Hilgerson.
Well, luckily right now we have a small number of faculty, and there's really, I think, two things that are, well, three things. One, masks. Two, we have developed these plexiglass. I have one sitting on my desk. It's kind of the prototype. I'll kind of show you these very large plexiglass sneeze guards. We've also recently sent out to all the faculty who are still off contract, choose your mask, you know, which one do you want, including the ones that are full-blown visors so that they can kind of lecture and talk while they teach. The other thing that's happening right now in the CTE areas is there are daily custodial cleanings that are definitely a little more deeper than usual. That's happening. So, and also the students are provided kind of those little bleach wipes, and they're cleaning their own areas every time they're done using them. So there's all kinds of measures. And I think probably the most important one is just the social distancing. So a classroom, our 100% occupancy in a classroom is really down to 40 to 50% depending on the room shape. So we're trying to get a lot fewer students. I suspect in the fall we'll be doing the model that is being referred to now as high flex, where you only bring in half or less than half at a certain time, and you kind of alternate that. So we're trying our best to think of every possible way that we can protect both students and employees and faculty. So, and it has been great to have the faculty serve on our COVID-19 response team. That team started meeting daily, then we were down to 3 times a week, twice a week, you know, which is good. Yeah. But the faculty input has been invaluable to help us figure out how to move forward.
President Parker?
Well, what we're going to be like Karen at a 37% capacity within our classrooms. Wow. And teaching more in a flex model. We're going to have as many CTE students as possible actually do their labs at our employer partners facilities. Especially the apprenticeship students will do their work in partnership with the employers. Our protocol is very similar to Karen's. When you come in, you have to report your temperature through an online app that we have. You have to share if you have any symptoms. Our students, faculty, and staff all are going through training before they come back to campus. And so they'll get that instruction through an online module, but also their first day in class to make sure they're following the protocol. The other thing that we're doing is we're kind of we're spread out on the North Mankato campus where we have a lot of high bay doors and it's one floor. And so to keep students, the CTE students kind of in a controlled space, they're coming through their lab doors and they only have access to a bathroom in their area. Outside of that, we know who's on campus so that we can do our cleaning protocol, keep them safe. Everyone's given, like Karen mentioned, a cloth face mask, as well as we'll have some face shields when more of the students and faculty start returning in the fall.
All right. I'm going to switch it up just a little bit. President Fitchner, I think you indicated that you're still do not have face-to-face. Is that correct?
We have face-to-face in a very, very small number of programs that have received waivers from the Secretary of Higher Ed.
I'm going to go to the questions in the chat box, and we're getting several now. So not necessarily all three of you, but if you'd like to weigh in on this first question, though, to President Fitchner, what sort of contingency plans do you have in place for your CTE programs if we go face-to-face in the fall and then the second wave hits?
Yeah, I mean, we're assuming that we're going to be more than likely predominantly online in the fall. I think that, I think we're probably in a different place than my colleagues in Nevada and in Minnesota. We're looking at small numbers of people on our campuses, hybrid classes, really limiting cohorts to make sure that we've got small number of people on campuses. But we are very much working on the plan of people come back and there's an outbreak or there's a targeted outbreak. How do we shut down and transition? Some of it has to do with how do you plot out the semester so that you are giving as much of the hands-on learning when you can do it at the beginning of the semester and trying to back in some of the theory. So a lot of our faculty are really trying to rejigger the curriculum in ways that would be able to adjust. But it's going to be a challenging fall. We're not going to even know until mid-June what the fall might even look like. And so planning is deeply underway. So it's certainly a challenging time.
Right. Either President Parker or President Hilgerson, same
Rick,
question.
if I could just share a little bit. I have a Mayo Clinic hospital in my region, and the CEO is on my advisory board, and that's been very helpful. Mayo runs 500 models a day of what the peak might look like regionally. And that has helped me to, in our administration, think about how we open up in the fall and when we might close down. But it's changing because they run 500 models a day. So initially, early on in the decision to open up for fall, they were telling me that because of the way we handled COVID-19 in the state of Minnesota, that the model would not peak, that it would blunt, and that it would stay blunt for a while and then go down. They thought that it would peak again. The second peak would be in January, but as early as late November. So what we decided to do initially was to shorten the semester for the CTE programs closing at Thanksgiving.
As we are as well.
Yeah, and so now, though, he presented again to us last week, and they think it might be October. And so I think that one of the things you really have to think about is how you work with the employers like we did. We're looking to do more of that. And then also looking at how you implement industry recognized credentials so that you can have those pauses and get students through.
Right. President Hilgerson, I'm going to switch it up for you, see if we can get through some of these questions. How about your career services operations at the college? What was their, how active were they during this time, or are they, and the outreach to our industry partners at Truckee Meadows?
So we do have a career services office. They've been doing everything virtually. And in Nevada, so much was completely shut down for several weeks, and we only started to begin reopening on June 4th. So, but they still are active working with students virtually, building our employer linkage list virtually. So they're doing their very best virtually. But right now, the unemployment rate is shot up about 11% in Northern Nevada, and it's closer to 30% in Southern Nevada. So this is just a very strange time for any kind of employment service. But we are still working as best we can virtually, and they've done a marvelous job.
President Fitchner, I'm going to switch the questions up. We're getting some wonderful questions, and keep them coming in the chat box. So if I ask one president a question and you have an answer you want to add, just let me know. But President Fitchner, one of the questions, have you found that synchronous or asynchronous model has been more effective in this online time?
So I'm not sure we have a good answer to that. I think we are trying a variety of different approaches. And I think the jury in New Jersey is still out. I think we're in the process of assessing what worked and what didn't work. I think there are benefits and negatives to the different strategies. So I don't have a really good definitive answer. I mean, we are learning as we go, but we are in the process of assessing what we did well this semester, what our colleges didn't do well, what we can do. We've launched some aggressive professional development efforts for faculty because many of our faculty have never taught online, and this is a new experience for them. Others are very, very experienced. So we're really in the process of assessing what has worked and what hasn't, and what can we do to make sure that we're prepared for the fall.
I would love to answer that, Rick, too.
Please do.
Well, I just want to say, so we actually surveyed students right before they left and had a great sample. And it's very clear that, at least from the student perspective, that the online education worked a lot better when it was synchronous, when it was live time using Zoom or Blue Jeans or Canvas Big Button, where faculty held their classes much like we're doing today. You know, that was, so we've also been really ramping up professional development. Faculty are thirsty for this. They've really just stepped up. They're doing a lot of training in the summer. I think they're realizing that if you can really structure a good Zoom class, or you know, that it can be pretty effective. And so we're heading into fall with many of our regular face-to-face courses moving into a synchronous format.
Well, I'm happy to report that at one end of the kitchen table for many weeks, I was there with the community college. My son, who is just graduated in high school, was at the other side of the kitchen table. And because of the synchronous model, I think I did pass the economics class that he was in. So that part was very positive. I haven't got my final grade back, but I'm hopeful that I did. Question from Kellen. And this is a question that we are going to get hit with. And I'm going to expand on his question. And I've already asked our legal team at the college, what will you do? And I'll give this one to you, President Hilgerson, because you mentioned you're taking temperatures when a student comes in. What if they say, you're not taking my temperature? I'm not going to wear a mask. Or the two scenarios that I have thrown out to our legal is, what happens the first time an instructor says, unless you have a mask in my office or in my room, you can't take the class? Or if a student says, if everyone else doesn't wear a mask, I'm not coming in. So who went to law school and who wants to answer this one?
Well, I will say that the Nevada system of higher education has code that really does elevate public health. And so now we're aligning our student conduct policies so that at first we encourage students to wear a mask or do what we need them to do. And if they don't, then we say, okay, then, you know, you can go home, or you can, you know, go to the principal's office, right? I mean, it's kind of.
That's why we have deans.
Yeah, right, exactly.
Well, and for us, we're doing the same thing. We're adding it to the student code of conduct. And not only that, it is policy for employees. If you're in a room with 2 or more people, you will have on a mask.
Great. President Fitchner, another question comes in. Many of us, probably you as well, have either dual credit, or in our case, we call it concurrent enrollment with our high school students. How are each of you handling that, and what are your plans for the fall? Especially, and specifically to CTE.
Yeah, so we've actually found that the dual enrollment, concurrent enrollment programs at our colleges, they've worked very, very well in this transition. Obviously, CTE is a challenge, but we've been very, very encouraged by the experiences that our high school students have had in partnership with our colleges in dual credit and dual enrollment. Most of our dual enrollment programs in New Jersey are more of the general education courses. We don't have a huge amount of the more CTE programs, which may be an advantage in this case, but a disadvantage in the longer run. But we found that the partnerships we have with high schools have come in handy and been very, very helpful to help students make that transition to online education and dual enrollment.
Right. Next question. Academic honesty and integrity with online remote assessments, hybrid learning, et cetera, or maybe not hybrid, but in the environment we're in. I guess, first of all, I'll expand on the question by Lonnie Nelson, and thank you everyone for your questions so far. Has it been a problem that you're aware of, and how are you handling that?
I wouldn't say that I'm aware of it, because if a student's caught in plagiarism, it goes through a process, and only through an appeal process does it get to me. So that's why I would not be aware of it and have not heard of one yet. The only thing I would say is, as we talked about online learning, and me being, I was a designer, machine tool designer by trade. That I know that hands-on components are very important. However, I would say this crisis has brought about an opportunity for community colleges and other universities to look at the models that have pulled enrollment from us in private institutions that are completely online, or have very good models of hybrid learning that we need to address, and the crisis gives us an opportunity to do that. And so I think that we have to think about innovative ways to understand plagiarism just like we would any other time. And I'll give you an example as a drafter. Back in the day, I guess I'd say, when I first started drafting, some of the work I did was manual, and some of my students did manual drafting. Well, a student could take a piece of vellum, which is drafting paper, and lay it on top of another student's drafting and plagiarize that way as well. And you wouldn't necessarily recognize it unless you laid those two on top of each other. And so I'm just giving you an example that plagiarism still exists. We still need to monitor for it and take corrective action. But we also need to make sure that we are addressing strategies to get better at online and synchronous and hybrid learning. And the crisis has brought about that opportunity.
I'm going to expand on a question from Annika. The original question is, when closing at Thanksgiving, what's the plan for the second semester in January? I'm going to expand on that a little bit and say, if you're planning on closing at Thanksgiving, what is your plan for your CTE classes? So that, are you front loading with the practicals and finishing with theory? Are you stopping at Thanksgiving? What is the plan for the fall semester if you're looking at trying to do what the experts predict, and that is miss that second wave? And then, of course, the original question, what about the spring semester? Dr. Hilgerson?
So first of all, at this point, we're not planning on closing early. Yeah, we've talked about it, but at this point, yeah.
Dr.
So maybe
Parker?
that question's better for.
Yeah.
Dr. Fishner, either one.
So we're not changing our schedule as a college, because our online courses and our liberal arts and science courses will continue through the full semester.
Okay.
All we're doing is accelerating the CTE courses, and so they'll be condensed. There'll be longer sessions every week, so that they can finish about 2 weeks early.
Okay, great. President Fitchner?
So we haven't made that decision either. We're waiting for guidance from the governor on June 15th about what even might be possible in the fall, and to what degree in person would be possible in the fall. So there's a lot up in the air. But again, it's really about front loading. I think the plan would be to front load as much of the practical as possible, backload the theory. But really it's about how much of everything that we do can be put online. Knowing that this virus is going to be with us until we get a vaccine, which may be quite some time.
Rick, I think it's important to say too for us that some of the theory will be online in the CTE courses as well. Right. And the faculty have really thought really hard about how to deliver demonstrations and those types of things online, so that when the students are on campus, they're actually doing hands-on work.
I know one of the exciting aspects at our institution is some of our CTE faculty, some of the older faculty, quite honestly, were some of the ones that stepped up the earliest to say, yeah, I can do this. I can make that happen and transition things to online. What approaches, and I'm actually going to answer this one the first time, or take the first crack at it, from Sasha Nelson, what approaches are you taking for your non-credit and community program offerings? All of us work with companies. In Salt Lake and in Utah, we're sitting at 9.7% unemployment, not as high as certain areas in the country, but we still have companies that are growing. And so we have companies that have onboarding a tremendous amount of talent during this time. And while we pivot and try to put things online with our non-credit partner training, our customized training, we're doing as much of that as we can. But we also send our trainers to on-site training at these companies. And of course, when we go on site, we make sure that we follow the guidelines that that particular company has. And then of course, our community program offerings, we have a uniqueness here in Salt Lake, whereas our governor set up a 4-color system, green, yellow, orange, and red. And right now, some of our campuses sit in the orange and some of our campuses sit in yellow. And so we can do certain things from a community standpoint in certain communities and certain campuses, and we can't do it others because we span we're the only comprehensive community college in the state. And so we span, if you've been to Utah, we're encapsulated by mountains, and we've got about a 24-mile north-south operation. And so it's been a situation that for us, we pivot depending upon where we're at, where the client's at, and where the community that we need to serve is at. And in our case, we need to be able to turn a switch on and off when the governor says, those of you in orange can now go to yellow, those of you in yellow can now go to green, or hopefully not the other direction. Anyone else want to tackle that one?
Rick, in Minnesota, our Center for Business and Industry, the governor never shut them down. What he did shut down is them offering training on campus. And so if it was an essential worker training at one of our essential employees, what the governor termed to be essential, they continued with that. And a lot of our training has been around health and safety, and we've continued to do that as an essential worker support, following CDC guidelines. And what's helpful about that is they have the experience to also share with the faculty and staff as they open up. And so that's been very helpful. As of June 1st, the governor has now allowed them to offer courses back on campus with a limit of 10 people. So we've begun that in the last couple of weeks. But we also do something that we had started throughout the state in partnership with the other colleges and universities called Live Online, and it's telepresence. And so that group of trainers have been well-versed in offering telepresence in conference rooms and in lunch rooms throughout the state with our employers, and they've continued to do that.
Okay. One more question. I apologize. I'll see which one of you wants to jump on this one, and then I'm going to ask for a kind of a 1-minute summation from each of you. Have you considered any attendance remediation for students who either contract COVID or are put in quarantine for 14 days because they may have been exposed to COVID?
We, looks like Karen, were you going to say
Oh,
something?
I was just
Karen?
going to say yes. Yes. I mean, I think faculty are all being very flexible and showing a lot of compassion, and I think the public health entities we're in alignment that if somebody is exposed to COVID, they need to get well. People traveling to COVID hotspots, we need them to quarantine for a couple of weeks before they come back. Yeah, so I think the short answer to that is yes. We're not just considering it, we're just doing it.
We're at 5 minutes before the hour, and we want to, we certainly want to be respectful of your time. There are some other questions in there that we probably won't get to, but thank you so much to everyone that's been here. The last question I have for each of our panelists, really, as I open this, as we all know, it's very redundant to say, but it's a time in our careers which we never prepared for. I'm not sure about anyone else, but my graduate studies didn't prepare me for a pandemic. And what are you going to take away from some of the pivots, some of the creativity, and some of the, I think, professionalism that has surrounded you with your peers, your faculty, and quite honestly, your students during this time when, hopefully we're beyond this pandemic. President Finchner, would you take the first opportunity for this?
Yeah, thank you. That's a great question. It's been a privilege to be with all of you today. I think it's an unprecedented crisis situation, and I think we all have seen so many people rise to the occasion across our campuses, our students, our faculty, our administrators, our partners. And while we are saddened by the public health effect and the sickness and the death of so many of our neighbors and loved ones here in New Jersey, I think it's brought out the best. We are reminded every day that so many people who are on the front line of this crisis in our state got their education through CTE programs. And so it reminds us that the work we do is so important, but it also reminds us that we need to continue to be more innovative. And so we are launching a whole series of initiatives to really make sure that we're working together across our 18 colleges more effectively. We're working with the business community more aggressively. This is a challenging time in so many ways. And I talked about the budget challenges we're facing. We have to find new ways to work together across institutions with higher education and high schools, with high schools, higher education and workforce development programs. So all of that is really in the works in New Jersey to really take this difficult time, build on the positives that really people have risen to the occasion, and make sure that we have a stronger New Jersey when we emerge from this crisis.
Thank you. President Parker.
I would say there's two things. One is, I mentioned earlier that every Wednesday I have a 90-minute COVID-19 update. And initially, it was through crises that it's led to the college, 2/3 of the college participating in that meeting every week and wanting me to continue. And so it's strengthened our communication. To Aaron's point, our commitment to each other and how we move forward as an institution. The second part is that I think you always take a crisis and look at the opportunity. And I mentioned this earlier too, that this is an opportunity to strengthen what we can do online, who we think can work from home and who we think cannot. And it's changed that norm, I think, that will not go back to where it used to be. And I think that everyone on the phone needs to, in this conference call, needs to recognize that. And so those are the two takeaways for me.
Great. Thank you. President Hilgerson.
Well, first of all, thank you for inviting me. This has been fun. I really appreciate having the opportunity to learn from the other panelists and also to share some of our updates at TMCC. I really appreciate it. I think I have two major takeaways. The first one is someone asked a question about the digital divide. I think the digital divide is getting smaller and smaller as a result of this crisis. And in some ways, I think that is a positive outcome of a crisis and an opportunity, as my colleague, Dr. Parker said. I think that's really true. I think that digital divide will get narrower. I think people who have engaged in the synchronous online venue have seen how some of those tools can really work. On the other hand, we also know that nothing replaces a wonderful face-to-face class. So I think people are really excited to get to a post-COVID world where we can engage face-to-face. But I think the outcome will be that we have a mixture, and students will have a mixture. We'll have more and more students who take one or two face-to-face classes and take a couple of online classes, and they'll mix it up a lot more. So that's my first takeaway. My second takeaway is that I think as a country, we will begin to invest in the CTE fields that connect to science. Things like biotechnology, things related to automation and medication, all of those things that can make America much more proactive so that we can control for viruses that surprise us in a much more effective and faster manner, and for the sake of our public health. And I guess I'll close by saying the other thing is I too realize that high achievers, they high achieve at home just as much as they high achieve at the office, and maybe even more so. So one of the things that we're worried about is just the stress and balance of life and work, because I don't think working from home has made it any easier for our high achieving employees. And so we're going to have to monitor that next year too. But thanks again.
Well, on behalf of ACTE, I want to say thank you to President Parker, President Hilgerson, and President Fitchner. Your expertise and willingness to share for this webinar series is very much appreciated. This is, as I mentioned before, this is webinar number 2 in a series of 14. You can go to acteonline.org, where you can find all the other webinars that will be in this series. I'd be remiss if I didn't say thank you to Alicia Heislip, Lauren Fillenbrown, and of course, Michael Connett, and our great executive director, Leanne Wilson from ACTE. Now is the time for us to stay together while we're apart, because it's really important that what we're going to do is share these best practices just as we did today. We only had an hour today, but imagine what would happen at the next conference for ACTE when we can truly get together. And I'm not sure there would need to be an agenda. I think we could get in a room and say, how did we do? And I think the commonality is we want to serve our students, we want to serve our communities, and we want to serve our industry partners. And if we do that with, I think if we do that with the creativity, the professionalism, and all that we bring to the table and all that we've learned, our communities will be better. So with that, Michael, do you have anything lastly to say? Otherwise, I just want to say thank you.
Thank you, Rick. Thanks to all of our presenters.
Thank you.
Thank you.
Have a wonderful day, and I apologize for keeping you a couple of minutes over. Bye now.